If you go to your regular doctor and you say, hey, I'm tired, I've got brain fog, I'm gaining weight and I feel off, they're going to run a standard blood test and look at fasting glucose. That's all they do. And if it comes back under 100, they'll say, you're fine. Right. I see ya. See you next time. Right. But here's the truth. That's just a snapshot. It'd be like judging your entire week based on a single second of your Monday morning. Right. And in functional medicine, we need more context. I want the full picture, not just a single frame.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Hey, Health Decoded listeners. Dr. Alessi here. Let me ask you a serious question. Are you tired of waiting until something goes wrong to finally see a doctor? At Alessi Functional Health, we take a different approach, the right approach. We believe true healthcare isn't about chasing symptoms. It's about preventing them in the first place. That's why we created the Alessi Total Care Program. This is a functional medicine-based membership that gives you proactive, personalized care year-round. You'll get access to comprehensive blood work and functional testing, custom doctor-grade nutraceuticals, deep discounts on labs, protocols, and follow-ups, as well as 24/7 direct access to your doctor, not just a 10-minute checkup that ends with another prescription. And here's the best part. As a Health Decoded listener, you'll get your first 3 months completely free when you sign up for an annual membership. That's on top of hundreds in savings already built into the program. This is your chance to take responsibility for your health and join a movement that's redefining what primary care should look like. Head on over to alessifunctionalhealth.com, click on our services tab, and go to Total Care. Learn more about this program and claim your exclusive podcast listener offer. Your health is your greatest asset. Let's protect it proactively. Welcome back to another episode of Health Decoded. I am your host, Dr. Alessi.
And your co-host, Matt Tack.
Man, nice. Coming in with the radio voice. I like it.
Yeah, well, I'm trying to change things up a little bit.
Well, you look good, man. You got the muscles on today.
Yeah, sun's out, guns out.
Sun's out, guns out, baby. Well, I'm excited. This is a really awesome topic we picked today. And we kind of do these, just so listeners know, we pick these in order of what we want to talk about because they kind of build on each other, and all these things that we are, digging into these different topics and educational pieces are related, right? And so it's like each week you get a little piece of the body and how it works and what you can do, and then we add to it, right? And so ultimately, we want you to be empowered with the knowledge to be able to take control of your health and then ultimately make the right decisions for longevity and for optimization. So today we're going to get into a really fun topic, blood sugar, and then why it's not just a diabetes issue, but it impacts everything. So blood sugar imbalances affect far more than just diabetics. Think about fatigue, anxiety, weight gain, brain fog, and even hormone issues. So in this episode, we're going to break down how blood sugar works, why it's out of control for so many people, and then what to do about it. We always like those actionable steps that you can take home. So let's just start simple, because if you don't understand what blood sugar is, none of the rest will make sense. So blood sugar, or blood glucose, is the amount of sugar circulating in your bloodstream. Pretty simple. It's your body's main energy source, and you need it to function. But here's the key. You need it in balance. Too much or too little, and things will start to fall apart. Now, every time you eat, especially carbohydrates like bread, pasta, fruit, or sweets, your blood sugar rises, right? Makes sense. You're ingesting blood sugar, or you're ingesting sugar, it's getting into your blood. That's normal. So your body expects that. And so in response, your pancreas releases a hormone called insulin, whose job is to act like a key, unlocking special receptors on your cells so that glucose can move from the blood into the cell to be used for energy. Now, here's where the problem begins for most people. We don't eat like our ancestors did. We don't eat three balanced meals a day. We graze constantly. Morning starts with a sugary coffee or toast. Mid-morning, there's a snack. Then there's lunch. Maybe it's like a sandwich and some chips. An afternoon crash, so you get some more coffee loaded with sugar. And then dinner, followed by probably some dessert and maybe a glass of wine. This is very common for a lot of people. So what that is that's a nonstop parade of blood sugar spikes, and every spike requires insulin. So the more often this happens, the more your cells get tired of responding to insulin and they start to ignore it. That's what we call insulin resistance. And that is the beginning of a metabolic storm. So here's the kicker. You don't need to have diabetes for this to be a problem. You could be 20, 30, 40 years old with normal labs, but still riding a blood sugar roller coaster all day long. And what does it feel like when you're on this? Basically, like you could wake up tired. You get a quick burst of energy maybe after eating, but then you crash pretty quickly. You crave carbs all the time. You crave caffeine or sugar for a pick-me-up. You feel foggy in the afternoon. You have mood swings, very common. Maybe you feel wired, but then tired at night. Maybe you're gaining weight, especially around the midsection, and you can't figure out why. All of that is related to what we call the blood sugar chaos. And honestly, the scary part, Matt, is how normalized this has become. So here's a quick quote from the Journal of Alternative Medicine Neurology in 2018. Even mild elevations in blood sugar are associated with an increased risk of cognitive decline and cardiovascular disease. So it's not just about avoiding diabetes. Blood sugar impacts your brain, it impacts your heart, and it impacts your hormones and inflammation. So even your ability to recover from stress or infection can be affected. So if you're dealing with like chronic conditions, fatigue, anxiety, brain fog, stubborn weight gain, even autoimmune issues, blood sugar imbalance is probably a large player in that game. So the bottom line is if you're riding this roller coaster of up and down spikes of blood sugar every day, your body is beginning to burn out to that. The good news is what we're going to talk about today is how you can take back control of this. And that's exactly what Matt's going to kind of get into here in the next piece.
And as always, we say, right, your health is in your hands. So this is the empowerment and the education component that we build on. But, what are the hidden symptoms of blood sugar dysfunction? But before we discuss how to combat this problem, let's dive into the symptoms. So because blood sugar dysfunction doesn't always wave a big red flag like diabetes, more often than not, it whispers and it creeps in really, really slowly. And most people don't even connect the dots. So now here's the question you need to ask yourself. How do you know if your blood sugar is a problem? Even if your doctor says your labs look, quote unquote, fine, right? Start with how you feel day to day, right? Do we take a measurement day to day on how you feel? Do you wake up groggy, even after 7 to 8 hours of sleep, right? Do you feel hangry between meals where you need to grab that bag of chips? Like you're just going to crash if you don't eat something absolutely immediately. So these are the things you need to think about and process through on a day-to-day basis. Do you rely on caffeine or sugar just to function in the morning or push through that afternoon slump, right? These are habits that people built, but we need to be cognitively aware of them. That's the blood sugar roller coaster. It's subtle, it's quiet, but it's exhausting, absolutely exhausting your system. Let me give you a few more red flags. Cravings, especially for carbs, sugar, or junk food. Do you ever have that? Energy crashes after meals or even the mid-afternoon. Do you have brain fog where there's just poor concentration or you feel like you're in this absolute mental haze where you only can see a tunnel? Do you have mood swings, irritability or anxiety throughout the day that just like appear to come out of nowhere? Maybe in the middle of a conversation, right? Waking up in the middle of the night, especially between 2 to 4 a.m. when you're hitting REM. Weight gain around the midsection. This is one of the biggest things that we see in America today, right? That stubborn kind that just doesn't budge with either diet or exercise. So let's dig into this a little bit more. Here's why it gets interesting. Most of these issues are often written off as quote unquote normal, right? Or chalked up as, hey, I'm aging, it's stress, or I'm just too busy. But in reality, they're metabolic warning signs. And what's really happening behind the scenes is your body is constantly trying to get your blood sugar back to balance. You just need to get it back to neutral. So neurologically, you are just trying to get back to neutral. But because your inputs like your diet, sleep, stress, and movement are off, it's losing that battle. You're constantly engaging with yourself, right? There's an internal competition that your body is requiring on a subconscious level, right? So you might have insulin resistance. You might not have insulin resistance yet, but your system is working overtime to keep stable, and eventually it won't be able to keep up. And I've seen this play out hundreds of thousands of times with patients, right? They come in saying, I'm just tired all the time, or I feel anxious, or for no reason, my weight is stuck. I can't burn off that excess body fat. And their labs might be normal, but functionally, their blood sugar is anything but. So now, let me drop a quick stat on that. And here's a quote from the Journal of Clinical Investigation in 2019. Insulin resistance can exist for up to 10 years before blood sugar markers show up as normal on a standard lab test. Have you ever seen the guys that get away with it in their 40s, 50s, but then in their 60s, they're pre-diabetic and getting in this diabetic dysfunction? This is what we're talking about. And we always want to blame it on the precursors. Well, those are of age-relating process, but there's things you can do about it. So 10 years is a long time, right? That means you could be on a path to prediabetes, as I said, or worse, for an entire decade without even catching it. That's why functional medicine digs deeper. So that's what we're doing at Alessi Functional Health. We're not just waiting around for a diagnosis. We're looking for the early signs of dysfunction and how we can tackle them. So this is what I want you to leave with here. If you have chronic fatigue, stubborn weight, or mental fog, cravings, anxiety, and poor sleep, trust me, you're not crazy. You're not the only one in the boat. You're probably just stuck in a pattern of blood sugar dysregulation. But here's the good news. It's fixable. Everything's fixable. You just need to know what to look for. And that's exactly what you'll get in this next segment. But here's a quick word from our sponsors.
This episode of Health Decoded is brought to you by Authentic Nutrition, the brand redefining what it means to fuel your body the right way. At Authentic Nutrition, they believe that what you put into your body matters. That's why every single product is crafted with clean, premium ingredients and dosed with maximum efficacy to ensure you're not just meeting your health goals, you're exceeding them. No fillers, no shortcuts, no gimmicks. Whether it's their advanced supplements for energy, recovery, or gut health, you can trust that what's on the label is exactly what's in the bottle. Authentic Nutrition delivers science-backed formulations that work as hard as you do. If you're tired of products that promise the world but don't deliver, it's time to make the switch to Authentic Nutrition. Elevate your health with transparency, quality, and results you can feel. Check them out today at authenticnutrition.com and use promo code Alessi15 to get 15% off. That's THENTIC nutrition.com, promo code ALESSI15 to save 15% and take the first step toward real, lasting health. Authentic Nutrition. Fuel your best self. Now back to the episode. All right, welcome back. Now that's great. That's, I love that we talk about like what people can expect and kind of what signs to look for, because it's all about those early warning signs, right? Being fatigued, being tired after 7 to 8 hours of sleep is not normal, just so people know. So those early warning signs are basically your body telling you something. Your body talks to us through things. And it's, I always like the example of the check engine light, right? Check engine light comes on in the car, doesn't tell you what's wrong, but it says that something's off. So then that's when you have to run diagnostics. So now that's what we'll talk about, is how
even
to know.
About that too. Not to cut you off real quick, but like even about that too, let's look at and evaluate that scenario, because that's the kind of the storyline, right? Is that when people get in their car, if there's something wrong with their car, they immediately go get that car fixed, right? They can't get to point A to point A, B, right? But then when there's a physical ailment, it's like, man, that doesn't feel right, right?
Yeah.
And how you're treating your body, it's like, then I'm going to push through this for 5-10 years. Is that something you want to push through for 5 or 10 years? Because eventually it will have a stopping point. So that's such a good analogy in terms of a description of the immediacy of how important your body is.
And I think you raise a valid point there that, hey, you can get a new car. If your car broke, you can get a new one. You can't get a whole new body, right? You get one. So you better take care of it and take some ownership. It is interesting to me how quickly people will like invest in their vehicle and, be quick to respond to any kind of problems with it, but delay their own kind of physical ailments for years until it, obviously gets to be too bad. But let's do this. Let's get into why or how to know if the blood sugar's out of whack and kind of, tests that we can use. These are some things that we use in the clinic as well, functional testing. So, now that we've talked about, okay, what blood sugar issues feel like, let's get into how you actually test for them, because this is where most people are going to go wrong. If you go to your regular doctor and you say, hey, I'm tired, I've got brain fog, I'm gaining weight and I feel off, they're going to run a standard blood test and look at fasting glucose. That's all they do. And if it comes back under 100, they'll say, you're fine. Right. Bye. See ya. See you next time. Right. But here's the truth. That's just a snapshot. It'd be like judging your entire week based on a single second of your Monday morning. Right. And in functional medicine, we need more context. I want the full picture, not just a single frame. So let's break down the core tests that I recommend for evaluating blood sugar function and what we use in our clinic as well. So number one is fasting glucose. Yes, we are still going to look at this, but optimal range is somewhere around 75 to 85. So if you're creeping up towards that 95 or higher, we're seeing that there are signs of dysregulation, right? You're still in that quote unquote normal range, but you're on the higher end. That's what we call functional, right? We're looking at that. The next one we're going to run always in tandem with this is a hemoglobin A1C. This shows a 3-month average of blood sugar. This is the standard medical cutoff, right? The standard medical cutoff is 5.7 for prediabetes, but I like to keep patients between 4.8 to the lower fives, 5.4, for optimal metabolic health. And there should be some fluctuation there. The next one we look at is fasting insulin. This is huge, and most doctors do not run this. Your insulin tells you how hard your body is working to keep the blood sugar stable, right? Go back to segment 1. We talked about what insulin does. So you might have a normal glucose and a normal A1C, but if insulin is elevated, anything above 8, that means your body is pumping out more insulin than it should to keep things in check. That is the early stage of insulin resistance. That if I see an elevated insulin but normal sugar, I say, okay, we have a problem arising, right? Something's bound to happen eventually when your body taps out. So there was a study out of the journal Diabetes Care in 2016 said that elevated fasting insulin levels, even with normal glucose, are predictive of future metabolic syndrome. Basically what I just said. So another test we run, and this one I can't say I run it a lot or all the time because I can gather what I need from the other 3, but an HOMAIR test, which basically stands for Homeostatic Model Assessment of Insulin Resistance. This would be, say, if I didn't gather enough information or it was more complicated. This method is used to assess insulin resistance, and it's basically a calculated score using your fasting glucose and insulin, and gives you kind of a sense of how insulin resistant you are. So the ideal range is under 1.5. And this test helps determine if your body is having trouble utilizing glucose for energy. So, beyond what we do, obviously, with the blood testing and checking symptoms and things like that, there's things that people can do on their own as well. And I always like to use this piece because it's empowering for them to say, hey, like, you don't need to do the blood testing if you can maintain, right? Or say, for example, we've gone through a protocol and we've helped someone to lower and balance their insulin, which we do all the time. We get people to go from diabetic to non-diabetic. It's awesome. But now you need to maintain that, right? And you need to stay ahead of it. So using things like continuous glucose monitors, these are wearable devices that you can stick on your body, and they have a little microfilament that goes into the capillary system in the skin, and they track your glucose in real time 24/7. The technology is awesome because it taps right into an app. You can open your app and it shows you what your glucose is in that moment. You go eat and you will see that number go up, right? You'll see the blood sugar rise. You go work out or you go for a walk, you'll see it come back down. And so they show how your body is going to respond to different foods, stress, sleep, workouts, and you can really get a cadence of what your body's doing on a regular basis. And this is really a game changer, because people will say, "Oh, I thought oatmeal was healthy," right? Everyone thought like oats are like the breakfast thing that's got the whatever. For some reason, they think it's healthy, but their CGM is going to show a massive blood sugar spike, or they'll see how maybe a poor night's sleep made their fasting glucose jump the next morning. And so when you can see that data in real time, you can start to make better decisions and more informed choices for how you're living your life. So let's be clear on this, and everything we're discussing. You don't have to wait until your labs are bad enough to make a change, right? We always talk about prevention and early intervention. And that's really the whole point of functional medicine. We look for patterns of dysfunction, not just a diagnosis. We look for early signs of decline or incline in markers that are still within normal limits, but maybe bordering on critical. And that's how we get ahead of things. Why wait to have a diagnosis or have a condition if you can prevent it in the first place? And so if you want to get ahead of diabetes, cognitive decline, hormone imbalance, cardiovascular disease, it all starts with knowing your blood sugar story. And more importantly, interpreting that story through the right lens. It's not, is it within normal range, right? That's not enough. Is this optimal for where I want my health to be, is the question you should be asking. So now let's do this. Let's get into some actionable things that you can do that are practical, that actually work. And these are the exact strategies that we use with patients to fix blood sugar and get off that roller coaster once and for all.
For sure. Now, here are the actual actionable tips, because I think this is probably the most important segment that we typically do. It's like we learn and we educate, we empower, but how do we put in practice, right? So here we go. Now that you understand how blood sugar works and how to test this dysfunction, even on a daily basis with the glucose monitoring systems, let's talk about the nuts and bolts of it all. So fix your food first. That's number one. Nutrition is the fastest way to stabilize your blood sugar levels. And here's how we coach patients through this. Start with protein and fat. Every single meal should be focused on those two elements. If you don't know, proteins is 4 calories per gram, fat is 9 calories per gram. You need to have an understanding of that, because it is calories in, calories out. So we need to have an understanding of how we have a proper balance. And fats slow down the absorption of glucose and tells your body it's safe and it's nourished. Fat also helps with satiety and blood sugar stability. So that's an important thing to know when you balance your proteins along with your fats in your meals. So here's an example of a typical breakfast, right? So instead of getting a bagel and an orange juice for breakfast, which is basically rocket fuel for a blood sugar spike, right? Go with like eggs, which you typically get about 6 grams per protein, some healthy fats being in an avocado, and maybe a side of greens. So that means it's telling your body, hey, we're cool, no panic needed here, right? So you're not going to get that massive spike. So limit naked carbs. And what are naked carbs? This is what I call carbs eaten alone, like a banana or crackers as a snack, right? Those are typically unneeded and not something you need throughout the day. It's probably a habit of you just grabbing and putting it to your mouth, right? For the satiability, but it's not going to last long. So if you're going to eat carbs, pair them with a protein or a fat and buffer that sugar spike. So here's a little bonus tip for you too. So try a 10-minute walk after a heavy carb heavy meal. So this literally can blunt your glucose response and lower your blood sugar naturally just by moving. How often have you eaten dinner and just sat down, right? One things that we do as a family is right after dinner, we walk. And so that's been a big thing because that lowers that response, right? So your metabolism needs space. It doesn't need the snacking all day. So if you're constantly eating, even those healthy snacks that you're like, oh, there's a little bit of protein in this bar, right? It's also filled with carbohydrates. And this is never letting your insulin levels come down, giving your gut and your pancreas that much needed rest throughout the day, right? So here's your aim for 2 to 3 solid meals a day. If you're metabolically flexible, you don't need to graze like a squirrel all day, every day. Hey, I need to grab this and grab that, right? So here's number 3, and I think it's probably the most important, maybe slightly under nutrition, but it impacts how you're going to eat throughout the day and what your metabolic response is going to be. And that's prioritizing sleep and stress management. All right. So poor sleep increases your cortisol, which raises your fasting glucose, even if your diet is absolutely perfect. So stress has that same effect. If you can spike your blood sugar level like a candy bar, if you don't have proper stress and sleep management, right? So patients that come into Alessi Functional Health nail their diet and still struggle with that blood sugar level. And then they ask why. And so then we clean up their sleep and taught them how to manage their stress. And that's where their lifestyle completely changed from a medicine component to a functional medicine component, approaching each day, right? So if you're tracking your numbers and still seeing that chaos, look at your nervous system. It's telling you something. It's constantly giving you feedback. And number 4 is, like we said, it's a lot like moving after dinner, but move your body. And we are massive believers in that strength training component. So muscle is your best glucose disposal tool, hands down. The more lean muscle you have, and we preach this all the time, the more your sugar your body can absorb without needing a ton of insulin all the time. All right. So strength training 2 to 4 times a week is one of the best long-term strategies to reverse insulin resistance. And I'm going to give you a little bit of tip. Put your phone in your locker, right? You want your heart rate to get up when you're doing those activities. So walking is way underrated. Walking is a form of resistance, right? So walking is a very good tool. Just a brisk one after meals, first thing in the morning to get indirect sunlight exposure to prepare your body for sleep. And then maybe between calls or even during calls can make a huge impact to lower that effect. So consider supplements if needed. We are big on supplementation, and we had a prior podcast that we explained the depletion in our nutrient source. So this is where we highlight the supplementation that we think could be crucial for you in really fighting that insulin response. So these can be helpful adjuncts, but are not complete substitutes for whole lifestyle meals throughout the day, specifically 3 a day. So berberine, number 1. What is berberine? Berberine helps improve insulin sensitivity. So think it like a natural form of metformin. Berberine is a great tool. Alpha lipic acid, right? It's an antioxidant that supports glucose uptake. Another one that is on the craze right now is magnesium. So many people are deficient in magnesium, which plays a crucial role in insulin regulation. So chromium is another one, and that supports healthy glucose metabolism. So as always, work with someone who knows how to personalize your needs, such as Alessi Functional Health, which can guide you through that process and guide you through all these processes of what functional medicine looks like and how you can approach them and start implementing in your day to day. But at the end of the day, here's the truth. Your blood sugar isn't just about whether or not you have diabetes. It's the foundation of how you feel, think, and age. So when it's out of control, everything else is harder. Weight loss, energy, hormones, brain function, all the above. And when you stabilize it, the whole system calms down and gives you a better cadence. So you feel steady, sharp, and strong at the end of the day. So we always go by this model. This isn't about perfection. It's about consistency. So eating real food, moving your body, getting good sleep, and respecting your biology at the end of the day. It's better to be consistently good than occasionally perfect. That's our motto. And if you've got the tools, now let's go get it.
Love that, man. That was awesome. Those are some really good actionable tips people can do. And we always say, start with one, right? Don't overload yourself and be like, I'm going to do all of this tomorrow. It's like, pick one, implement that for a week, make sure you dial that in as a habit, and now add to that habit stack, right? The walking after meals is probably the easiest one people can turn around and do today. So Love that. Thank you for joining us. Always, to learn more about how we can help diagnose, reverse, and heal blood sugar and metabolic conditions within our functional medicine programs, go to alessifunctionalhealth.com, schedule a consultation with myself or one of our other doctors, and let's create a personalized plan to get you to that lifelong health that we talk about. Listeners of the podcast are always going to get exclusive discounts and price reductions on all of our protocols and lab tests.
And as always, if you found today's show, please like, subscribe, and share this episode with someone who needs to hear it. That's how we grow this message and change their lives as well. And want to get in touch with us or be featured on an episode, email us questions at AlessiFXHealth, ask at AlessiFXHealth.com. And then if you want to just be more empowered and educate yourself, we have some great resources on our website at AlessiFXHealth.com. And you can sign up for our newsletter, check out our resources page to learn more about our approach to number one, nutrition, and also cutting edge therapies.
Thank you for tuning in to Health Decoded, where we break down the science, bust the myths, and help you take control of your health naturally. Until next time, stay curious, stay empowered, and remember, your health is in your hands.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask at alessifxhealth.com. That's ask at ALESSIFXhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.